As a neurosurgeon, I treat a lot of patients with subdural hematomas. And what that is a collection of blood between the brain and the sac around the brain. So as you get older, your brain shrinks, and there's a sac around your brain called the dura, and there's veins that connect the dura to the brain. And so as your brain shrinks, those veins slowly get stretched. Now, if you're in a car accident or you fall or you just jostle your head pretty vigorously, those veins, those stretched veins can break and fill up that space between the dura and the brain with blood. And that's why it's called a subdural hematoma, because it's under the dura, subdural. And if it's a severe hemorrhage, well, it's life-threatening. You have to come into the hospital and we have to operate on you right away to get the pressure off the brain, or it can kill you. But for majority of the people, they just get a headache and they go home and they sleep it off and they actually get better until 2 or 3 weeks later when they develop severe headaches, sometimes problems moving half of their body, and they come into the hospital. We get a CT of their head, and that blood that had originally accumulated outside the brain but inside the dura has now liquefied. And as it liquefied, it expanded and put pressure on the brain and now is symptomatic. And the reason it liquefies is because the body naturally wants to break down blood. That's why if you get a bruise, it starts off red, then turns blue and purple, then green, then yellow, then brown. That is the breakdown of that blood. The same thing happens up here in subdural hematomas. The body breaks down that blood, and as it breaks it down, it sucks water in from your body. It's called an osmotic effect. And it basically, as it sucks that water in, it expands and pushes on the brain. So I'll take those patients who have symptomatic chronic subdural hematomas, which is what we call them, and I'll take them to the OR and I'll cut their scalp and I'll drill a little hole in their skull and I'll drain that blood out like motor oil. And after I do that, most patients do fantastically well. They go home and they get back to normal life within a couple weeks. This is just one of the things I deal with as a neurosurgeon, and it's very common. If you want to hear more from me, I tell a lot of stories, and I usually connect them with ways that we can learn how to live better lives through a health and wellness lens. My podcast is called the Dr. Kumar Discovery. You can find it on any major podcast platform. You just have to search the Dr. Kumar Discovery, and you'll find me there. So please check it out, and I hope to see you there. Cheers.